Hi, my name is Charlie. I'm a retired cardiothoracic surgeon. I worked with Dr. David Halley, one of the inventors of the X10. I retired about 7 or 8 years ago, had a chronic knee problem, just recently needed to have my knee replaced. The surgeon told me that it would be 2 years before I'd be back to normal. I had heard so many bad things about a knee replacement being in the medical field that I was probably a little hesitant to have it done. That was probably delaying my decision by 2 or 3 years at least, by not wanting to go through the rehabilitation, which I had heard was such a painful process. Dr. Halley said that he has this wonderful machine that would help me in my recovery, and I've used it now for the last 6 weeks. I'm not very techno-savvy, but I found it very easy to use. My extension was fairly good the first time I used it. I think I got to maybe 5 degrees, but my flexion was maybe 50 or 55 degrees of flexion, which is very, very poor. I would gain probably 10 to 15 degrees of flexion a week. Now after 6 weeks, I've reached 130, which is a normal knee, and my extension is at 0 degrees. I was given this X10 Journal. The objectivity of it was so great. It wasn't subjective at all. You could see the numbers, you could see how much pressure you needed, you could see your range of motion, and that to me was the greatest advantage of the X10. Plus it was something that you could do anytime you wanted to, because it was very readily available here at home. And I did it 2 to 3 times every day for 30 minutes, and I think that certainly improved my rehabilitation process. But I know of nothing else where you can get the extension and flexion capabilities of the machine. I owe a lot to the machine because I think it was able to be used without pain. I think the outpatient therapy as well as the X10 complemented each other tremendously. If I had to choose one, it would probably be the X10, just from the standpoint that it was in the house and I could do it when I wanted to. In my mind, the X10 was a wonderful asset in my rehabilitation, and one that I think expedited my rehab tremendously.
He's had an excellent recovery at this time, which in my opinion would put him in the upper 99%.